All right. It's my pleasure to introduce our first resource presentation. Dr. Celeste St. John Larkin is a child, adolescent, and perinatal psychiatrist and associate professor at the University of Colorado School of Medicine and project director for Colorado Prosper. Alex Andrews serves as the administrator for the Office of Colorado Mental Health Access Programs within the Department of Psychiatry here and is also the program manager for Prosper.
Hi, everyone. We'll just have me speak quickly so we can get to lunch. I'm actually really excited to follow someone from Massachusetts because our program is based out of off of MCPAP for Moms, which has been around for 10 plus years. And originally, the original Child Psychiatry Access Program is called MCPAP from Massachusetts Child Psychiatry Access Program that's been around 20 plus years now. So this is our version. We have HRSA funding from the federal government, hopefully for the next 3 or 4 more years. We're really excited to share this with you. We have a table out there, so come get some more swag if you would like. So our target audience is healthcare professionals or anyone taking care of moms, babies, families during pregnancy or even preconception and the first year postpartum. So the core service is psychiatric consultation, so peer consultation with a reproductive psychiatrist that are on our team here at Women's Behavioral Health. We also offer education and training, and I'll show you slides of our team later, but we have a great resource and referral coordinator to provide resources back to you to share with your patient. So the key point is that we're not patient-facing. We don't take over care of the patient, but we help that care get provided in the medical home, in hospitals, in birthing centers, and things like that across the country, because we know the risks of things when it doesn't go well. We recently added this to sort of say what can we actually help with? So we have been focused on making a NICU card, but we've also worked with Nurse Family Partnership and doulas and people from DHS, social workers could call us, therapists could call us, psychiatrists call us, and psych nurse practitioners, because as many of you may not know, reproductive psychiatry is not a core part of residency training. So you only take care of pregnant or postpartum individuals if you happen to seek out an elective or see them in your clinic and you have someone who gets pregnant. So we take calls from anyone. This is just kind of an example of some things you could call us about. Positive screening tests. What do I do next? Talking about someone who's on multiple medications and breastfeeding. Someone who we've had actually a lot of calls where the primary care calls, like this last one, someone is using fentanyl and methamphetamine. What do we do next after I've started her on something? Or we can talk through assisted treatment. Caitlin is one of our consultants, Dr. Klee, so we are prepared for those kind of questions. I'll be sort of quick here. These are the 3 core components. So the other main take home is that this is free. It doesn't matter what insurance your patient or client has, or if they have no insurance. We've worked with refugees, immigrants, all of those sort of things if people don't have any care. And you'll notice purposely our branding is not university-based so that we feel like we can reach across hospital systems and really be a little more independent, since we do have federal funding that was awarded to our state flagship institution at CU. This is the phone number. We are available Monday through Friday, daytime, so it is not an urgent care or crisis number. We have those phone numbers on our website, but you can leave us a message after hours. There's also an online consultation option to put in a message, and we'll get back to you the next business day. So Sarah Collins answers the phone and takes a little bit of basic info. We don't need the insurance numbers, but what type of insurance do they have? Where do they live? So we can think about really curating the resource list to give back to you. If desired, and we hope you will want to talk with one of our perinatal or reproductive psychiatrists. We have pictures at the end. We're very nice people, and we enjoy talking to you whether or not you're a prescriber, and that helps build the education piece that you can carry forward to more complex cases. After the call, we send a summary back of what we talked about, as well as the resources. And again, it's not that we're sending them directly to the patient, but it's a curated list of people who do perinatal mental health. We have a whole really good list with support from some of our team in the community, such as Heart Beauty, of which places will take a pregnant woman for recovery services, which substance use place will work with mom and baby together. So those sort of things. And to that point, we did really intentionally build in giving people other things like peer coaches and mentors and people with lived experience. So we really built in that to be also focusing on what is linguistically appropriate, culturally congruent services. We really tried to build in a way to decrease the health disparities that we know happen in infant and maternal mortality. So yeah, Hard Beauty has been a great partner for us. We've also worked with Alma that has peer mentoring for mental health specifically. And then because we are connected with women's behavioral health here at the university, we sort of know what other resources are available in the community that maybe our folks in more rural areas don't know about. So there's a perinatal mental health intensive outpatient program now, which recently also just added a virtual option. So they take nearly all insurance, including Medicaid, and can that's 3 mornings a week. So if people need more intensive mental health support, maybe to avoid hospitalization or coming out of the hospital, it is not a substance use one, but we are connected one, and there's things in the works, as some of you may know. So hopefully in the future we can have those, but that can be offered statewide. And so, we're really trying to reach the rural areas to provide resources. So at the end of time, the other option, which some of you have heard us talk about at the table, is that we, education is the key component. So HRSA really views this as a workforce development grant. So we want to support all people in the state taking care of pregnant and postpartum individuals. So we can do any of these trainings for free. We did an ECHO series, but it wasn't that well attended. So we are doing more asynchronous modules that'll be available with CME online. So we can let you all know when those are coming out. Feel free to sign up at our table for our newsletter, and then you can stay in the loop. I just wanted to share quickly, since we have had the phone line running for just about a year, since August last year. These are the counties that we've reached with where people have called us for consults. We have practices that are registered. It just went up to like 35, and now our total is closer to over 9,000 covered lives in the practices that we are registered with, but you can call us without being registered. So the phone line's available. Alex, do you want to say something real quick about COMAP, that we have a whole lifespan approach? But yeah, more than half of our patients are receiving Medicaid. We're getting calls from all ages, but we would like to reach all the counties, so don't hesitate to give us a call. I'll kind of skip
that up there. Yeah, so Celeste mentioned COMAP, that's the Colorado Mental Health Access Programs. And those mental health access programs like Prosper, here we're really lucky we have a lifespan approach. So if you call that same 1-888 number, you're going to get access to all 3 of our programs. So if you're seeing patients or you have clients that are child, adolescent, perinatal, or their other adult geriatric populations, you can call that same number and access any of our team members that do the resource referral, curation for you, or the psychiatry teams that Celeste has been talking about.
I'll leave up our QR code. Come and see us at the table if you have questions.
Thank you so much. Show of hands. Raise your hand if you had heard of Prosper before. Okay, so about half of you have heard of it. Okay, that's great. Well, for the other half, make sure you visit the booth, get information, and if you have questions, please reach out to Celeste, and we'll make sure that our chosen listserv includes all of the educational offerings that you'll be having. All right, we are at lunch. Feel free to grab some food, sit at tables of people that you don't know, so you can make new connections, and then we'll see you back here at 1 o'clock.